Hello and welcome to COVID Conversations here on WNCU 90.7 FM. I'm Kimberley Cartwright, News and Public Affairs Director at WNCU, and I'll be your host as always. And we are using this Zoom platform to talk about how COVID-19 is affecting our world. And to begin our show today, here's a note about a new survey. Despite the uneven effects of a global pandemic on communities of color and those with lower incomes, many people do not recognize the fact that racism and health are connected. This is according to survey results released from the nonprofit RAND Corporation with support from the Robert Wood Johnson Foundation. And here to talk about the survey is Katherine Grace Carmen, and she is senior economist at RAND Corporation and the lead author of the report. Katherine, that's a mouthful. Welcome to COVID Conversations.
Thank you so much for having me.
Yes, let's get started. What is the name of the survey and why is COVID research like you're doing important?
This survey is the COVID-19 and Experiences of Populations at Greater Risk survey. We are really interested in this work in understanding the views and values that people have in our society and how those are influenced by the effect of the COVID-19 pandemic. And so we're actually following people over time to see how their values and views change with the pandemic.
So how many people have you surveyed?
We've been surveying more than 4,000 people. This is the second wave of surveys that we've conducted with these people.
So it's going to be more than one wave?
We'll be talking to the same people 4 times.
The same people 4 times. That's
yes.
Very interesting to see. I guess to see if their moods and opinions change about COVID.
Yes, we were really interested to see if their values, particularly around racism and structural racism, changed with COVID-19. The pandemic has hit some groups much harder than others. Particularly people of color have been much more likely to be infected and to die from COVID-19. And we wanted to see if the pandemic would change how people view health and the connection between health and racism in our country.
So many lives have been lost during the pandemic, specifically among people of color. Why do you think perceptions have not changed among this demographic about health and about racism?
So as much as I thought that this might be the moment, there's so much information in the news about the differences of the impact, and there were the George Floyd protests and all of this attention. I think that it's really hard to change people's values and views. These are things that are ingrained in the way we think about the world, and it takes time to make those changes. So that's one of the reasons we'll continue to follow people to see if over time there's more and more movement.
So that's very interesting because like George Floyd, I mean, it was something that shocked not only the nation, but shocked the world. So it seemed like it would like be a bump in the road, maybe to knock people into a different kind of consciousness, but that's not so.
But some people, but not as many as I thought might change their views.
All right. So let's talk about the survey itself and how it was made up. So what questions did the survey seek to answer? And why was it so important to find this out?
So we were really interested in understanding views of structural racism. I should say, when I talk about structural racism, I'm talking about the way that our society and our history have changed the opportunities that some people have, particularly people of color, and the way that some groups have been disadvantaged over others. So we were interested in that. We were interested in understanding people's views about access to healthcare, and whether or not they saw opportunities for positive change as a result of the pandemic.
I want you to give me like an overview of the people in this survey that you collected. Are they all African-American over 60 or are they all Hispanic over 40? So what was the makeup of the demographic that you were trying to get information from?
Our survey looks at individuals with household income less than $125,000 a year. So we're looking at lower and middle income households with more Black, Hispanic, and Asians than are found in the population. And that's so that we can look at differences across racial groups, racial and ethnic groups, and talk about those differences and understand them better.
So would it be, you said people with the same incomes? So
they all have income under $125,000.
All under $125,000. So was it skewed more to Black people? Was it skewed more to Hispanic people? Was it straight down the middle?
So we actually use a statistical technique to make the results representative of that group. So when I say, like, for example, less than half of respondents believe that systemic racism is one of the main reasons of people of color have poor health outcomes, that's a statement generally about people with incomes under $125,000. But then I have the ability to also say that Black respondents are much more likely than white respondents to believe that systemic racism affects the health of people of color, because we have more Black respondents in our survey.
Okay. Can you talk about what you learned about systemic racism despite the virus's spread across the country?
Sure. So one thing that we learned is that, as I just said, more than half of Americans don't recognize systemic racism as one of the reasons that people of color have poorer health outcomes. Another thing that I think that's really interesting that we learned is that people seem to feel more comfortable attributing differences in access to healthcare to income rather than to race. So we asked, do you think that lower income Americans have a harder time accessing healthcare than higher income Americans? And many people said yes. But when we asked, do you think Black Americans have a harder time accessing healthcare than white Americans, people were less likely to agree with that statement. And the data that we have from other sources about actual people's ability to access care suggests that it is actually harder for Black Americans to access healthcare. But that's not something that that people in our society recognize.
What drives that? It seems like it's in a bubble of some kind that is outside of reality.
I think that people who haven't experienced it themselves, they don't know that it's there. It's hard for them to see. I think one reason might be that people don't want to believe that it's there. I think that it's hard to know. I think that there's also possibly, but we didn't really dig deep into this in our results, that people have been trained, particularly white people have been trained to say that that they're colorblind, and therefore this can't possibly be happening because we're not supposed to see color. But it's something that people need to realize is actually happening. But there is hope. There is hope in our survey.
We're all looking for hope of some kind to take us to another place where everybody has equal access to healthcare, and people feel like they're getting quality healthcare when they're sick.
So the majority of Americans in our survey say that they believe that it's the government's responsibility to provide equal access to healthcare, to provide everyone access to healthcare. And the majority of people in our survey see the pandemic as an opportunity for positive change. And when we asked them, what do you mean by that? The thing that they pointed to the most was improved access to healthcare. So I think that's something that leaders can take forward as we move into this new administration, that there is support for improving access to healthcare for all Americans.
So I find that very interesting too, that people think that government should be responsible for good healthcare. Why not hospitals and corporations that are healthcare providers? Any indication about an answer to that question?
I think that it's not something that we talked about in our survey, but I think that it's about making sure that everyone has access. And that is something that needs to happen at a higher level than just each individual organization.
Mm-hmm. So how do you explain this statement in your report as from your respondents. They quote, see the impact of low incomes and living in a rural community on a person's health, but race isn't viewed with the same gravity. Is that something that you answered previously, or?
Yeah, that was what I was saying before about how we asked about the access to healthcare for low income versus higher income and Black versus white.
Okay, can you talk about this point that was brought to light in your survey? More than 70% of respondents see the pandemic as a moment of positive change. You talked about that too a little bit. So next question, do Black and Hispanic respondents trust the government's handling of COVID-19?
So we asked people about their trust in government, and I think there's two important things to point out. First of all, people trust their state and local governments more than they trust the federal government. And that's something that we see not just in this moment in time, but something that we see over time. But we also see that Black respondents trust the government less than white and Hispanic respondents. And that, I think, is also not surprising given the history of structural racism in our society.
Okay, so as far as education with those government leaders that you're talking about to bring about different outcomes for different people, then how is it that you're talking to those leaders about the results that you're finding with this survey?
So we are sharing our results with state and local government leaders, partially through or doing these kinds of public media interviews around the country, but also distributing our results widely to different organizations. So
you are doing this survey, and you're doing it with 4,000 people. So you said, how many times are you going to go back to this particular group?
So we've talked to them twice already, and we'll go back to them 2 more times, probably in a month or 2, and then again later in the summer.
So how are you keeping track of 4,000 people? Yeah, that's a lot to be able to go back, and then maybe too, are people dropping out of the survey? Do you get more people to come in? How does that work? And
we do lose a few people. We do lose a few people over time, but mostly they're staying in. We're making it worth their while.
So to talk about the duration of time and like maybe prospects for the virus that's coming up, and you tracking these people with COVID. So what are the outcomes that you're thinking about as the vaccine for the virus becomes more available for people in these communities?
I think that there's 2 issues related to vaccines that will be interesting. One is how trust in government relates to take up of the vaccine. People, the government is responsible for not only approving vaccines, but also in this case, administering the vaccines. And so it's really important that there be state and local government involvement in the administration of vaccines, because of the greater trust that people have in their state and local governments than in the federal government. I think we also have some interesting results about people's beliefs about priorities. That's not something that I think maybe we put in our press release, but we asked people what groups they think should be prioritized. And those largely fall in line with the recommendations of the CDC. And I think that that's really good, because that means that there'll be some acceptance and hopefully compliance with the general prioritization. I myself, I think I'm in the very last group, so I'll be waiting, but eagerly waiting for my opportunity to be vaccinated.
Yeah, I'll be eagerly waiting my opportunity for the vaccine as well. I wanted to talk about have you also surveyed any white people about COVID-19 and how they feel about racism and healthcare?
Yeah, there are white people in the survey as well, and they are less likely to identify or to acknowledge that there's racism and the impact of racism on health. And that's something that we need to work on, myself included, as a white person.
Thank you so much. And we have come to the end of our time.
Okay.
So I would like to thank you. I've been interviewing audience Katherine Grace Carmen, Senior Economist at RAND Corporation and the lead author of a new report on race and health. And I thank you very much. It's been a pleasure having you. And I look forward to information about future surveys,
Thank you.
how people are really, really coping and really thinking about health and racism. So I appreciate your information today.
Thank you very much.
Yes. And thank you, audience, for listening on WNCU, and thank you for watching also on Zoom. I'm Kimberley Pierce Cartwright, News and Public Affairs Director here on WNCU. Until next time.